how do you measure obesity and what are the Indian guidelines on it?
So that's a good question. So obesity traditionally by insurance companies was measured by BMI, and that is something which we recognize, that we measure it through body mass index. And now globally, the Lancet Commission has come out with a report. We had reported in the Indian Obesity Guidelines way back in 2007, and we also have an Indian Obesity Commission. Dr. Mishra is one of them, I am one of them, many of us are there. We have felt that we are thin fat Indians. So in the Indian context, it is the waist circumference and the waist to height ratio which is as important as just a simple yardstick like BMI. So from a BMI yardstick, we measure obesity as anybody about 25, 27 and 30 as overweight and obesity. But we feel that anybody between 23 and 25 BMI is overweight and anybody above 25 is obese. Having said that, if you have extra fat in your body composition or you have fat at an ectopic tissue like the liver, the epicardial adipose tissue, then also it contributes to the sinister complications of obesity. So the obesity definition is undergoing a change. And more than obesity, I like the term adiposopathy, which means that the fat cells are sick and they are diseased. And adipocyte is the cell for fat, and adiposopathy is the term for fat. And therefore, from an Indian context, we are thin fat Indians, which means we have less muscle mass and more fat mass. Traditionally, African Americans or the Caucasian whites, they have more muscle, less fat. But we as Indians, because we have been storing more and more fat, in our body composition, we have more fat and less muscle. So we have a dual jeopardy of a term called sarcopenic obesity. Sarcos means muscle, penia means less muscle. So we have less muscle and more fat in our body. And therefore, the Indian definition of obesity definitely has undergone a change. And therefore, if you want to say that somebody has abdominal obesity, we take a measuring tape. For a man more than 90 centimeters, for a woman more than 80 centimeters, it will contribute to abdominal obesity. Or if the BMI is more than 23, or if there are more than one comorbidities like hypertension, diabetes, liver disease of fat, or a heart disease, then it will contribute to obesity. So obviously, from an Indian context, we are undergoing a change and we are investigating newer metrics like waist to height ratio. Also, it's important to remember how strong is your muscle mass. If you do a simple hand grip test, you can easily measure your muscle strength because muscle mass and muscle strength measure sarcopenia. So as you put on weight and fat mass, you also have less muscle mass, and this equation of fat to muscle has led to an explosion of diabetes, heart disease, blood pressure, cancer in the modern Indian population, urban and rural both.